welcome to this Ksoga Zonal event on this pleasant evening. Now I request the dignitaries to take the dais. Respected Chief Guest Deputy Commissioner of HASSAN, Shri Girish, sir please. Guest of honor, Dr. Satish, DHO HASSAN. Ksoga President, Dr. Basavai Sajjan sir. President-elect Dr. Kasturi Donimukhu, Chief Secretary of Ksoga Dr. Engineer sir, Secretary General of Ksoga Dr. Bhatia, President of HASSAN Society Dr. Savitri. Dr. Gurgaja sir, President Ksoga, please sir. Let us begin by invoking the blessings of our meeting. Invocation by Dr. Visharaj.
Schedule, he has come to inaugurate today's function. I welcome you, sir. I also welcome today's guest of honor, very honest and very encouraging District Health Officer HASSAN, Dr. Satish Kumar. He has agreed to release the book authored by our senior member, Dr. Hemlata. I welcome you, sir. On behalf of Ksoga and HSOG, I would like to welcome Chief Patron of Ksoga, Dr. M.G. Hiramat sir, who is constantly guiding and encouraging all the activities of Ksoga, and of course he is the backbone of Ksoga. I welcome you, sir. I would like to welcome outgoing president of Ksoga, who is very active, a fun-loving and a jovial person, and who has successfully conducted many events during his tenure. Heartily welcome you, sir. I welcome the incoming president, Dr. Kasturi Donimat, who has come with lots of plans to carry it out during her tenure. We are sure that she will successfully take Ksoga to a greater heights. I welcome you, madam. I welcome Dr. Nagraj, patron of Ksoga, for this program. I welcome Dr. Ambrish Bandiwad, past president of Ksoga, to this function. I heartily welcome Dr. Pratap Kumar, past president of Ksoga and the faculty of today's program, CME program. I welcome Dr. Shobana Patte, the immediate past president of Ksoga. I would like to welcome Dr. Vidya Tobbi, madam, ex-officio member and Foxy coordinator to this program. I would like to welcome very dynamic and energetic Secretary General of Ksoga, Dr. Bharti Rashekar, who is the guiding spirit of our society and a mastermind behind organizing today's program. I welcome you, madam. I welcome Dr. Durgadas Asrana, treasurer of Ksoga, who is actively participating in all the activities of Ksoga. I welcome you, sir. I welcome Dr. Manjula Patil, a website coordinator and joint secretary of Ksoga, to this function. I would like to extend my warm welcome to all the executive committee members of Ksoga who are constantly guiding and supporting all the activities of Ksoga. Dr. Suman Gaddi madam from North Zone, Dr. Shobha Bembalgi from Northwest Zone, Dr. Shobha Gudi from South Zone, Dr. Sri Lakshmi from Southwest Zone. I welcome all the chairpersons and secretaries of various committees of Ksoga. I welcome Dr. Padmini Prasad madam from I welcome Dr. Sonia Mandappa from Safe Motherhood Committee. I welcome all the esteemed delegates all over Karnataka who have come here and those who have logged in to participate in this program. I welcome all the members of HASSAN Society who are actively participating and working hard for the success of today's program. I welcome all the media persons who are present here to cover the news. Once again, I extend my warm welcome to each and everyone. Thank you. I would like to welcome Dr. Madhu, Secretary of Davangere OBG Society, and I welcome Dr. Rajalakshmi from Manipal OBG Society Secretary. Thank you.
Thank you, madam. Now I request all the dignitaries on the dais to begin this ceremony by lighting the lamp.
शुभं कुरुत्वं कल्याणं आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणं आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्परमानन्दः दीपज्योतिर्नमोऽस्तु ते शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः
Thank you, dignitaries. Now I request Dr. Basuraj Sajjan sir, outgoing President Ksoga, to address us for few minutes. Please, sir.
ಎಲ್ಲರಿಗೂ ನನ್ನ ನಮಸ್ಕಾರಗಳು. Good evening to all. I am the president for the Ksoga from 21-22, where the COVID has started. I have taken the charge as a COVID president from Donimat. So I am always in between MG Hiremat and Donimat, only mats. I don't have any other man to have a choice. So I have taken the charge from her in the small hospital where nobody was there. It is an installation of a president alone because COVID. Wearing a mask, nobody knows that I have taken charge. Dear friends, this is a fact when I have taken. And luckily, with the Dr. M.G. Hiremat, very dynamic, founder of this Ksoga, and he is a chief patron where he has done hundreds of webinars. If he is there, he has done all the work. It is a 31 years Ksoga because of M.G. Hiremat, sir. If I am here today, because of him. And sir, Deputy Commissioner, very smart, young, dynamic, Girish Kumar, sir. We are happy to welcome you for this installation ceremony, sir. Always in my program, in my COVID time, I used to meet only I am a treasurer. And our great M.G. Hiremat sir has told me, Dr. Sajjan, you give one photo. Sir, DC sir, with your kind permission, can I tell few words with your permission? Thank you very much, sir. Thank you. Sir is very busy. In spite of that, I have to tell so many things to sir. Ksoga, how it is born, how it is brought up, and now it is a well-built, well-nourished, good-looking Ksoga. We are handing over to a Dr. Donimat. How she will manage? She will give a very good tonic and support because she is a professor and HOD. Since 8 years, she is with me. 2 years treasurer, 2 years secretary, 2 years EC member. No jump, no gap. Continuously is occupying a chair. But dear friends, since 20 years I suffered and followed M.G. Hiremat to get a chance, but I didn't get any chance because there was no demand, no money, no treasury, no accounts. At that time, I was a treasurer. Okay, whatever it is said and done, the Ksoga has grown up like anything. It is the number one society in India. There are so many foxes there, but Karnataka is leading and done a tremendous work. And we have started 24 societies and 24 chairmen and a college of education, FKCOG. So many things have taken place in my period. I am very proud to say that in a COVID period, nobody is coming, nobody is attending. The laptop is on, but they are inside. for so many works. They are present in the beginning, at the end nobody was there. They are under makeup, they are under OT, what not, so many things. Whatever it is said and done, dear friends, all have supported for my year, my programs. Madam Padmini Prasad has come, Sonia Mandappa has come, our Bandiwad friend has come, Pratap Kumar, great teacher of the world and India, and he is a well-known speaker. Today he is there, and all seniors are there here with all their grace, and with special thanks to Dr. M.G. Hiremat. If he has not taken inside the Ksoga, I was not here today as a president, and I am now, after few seconds, I will be an immediate permanent past president. Nobody can shake me, but they can shake Donimat, shake that president-elect Vidya Thobbi madam. Other youngsters are very interested to come to the Ksoga. We welcome all to become a member, to become a secretary, to become a president, and we have made a 4 more society in Koppal Medical College, Haveri Medical College, North Karnataka, and also one more is there. Now you are showing my data, biodata is too late, like a COVID you are showing now. You would have shown it early, but whatever it is said and done, I thank everybody and I wish a grand success for the future. And my friend DHO is there, Satish as a DHO. I was old DHO from Haveri. I worked as a DHO, and he is my friend, and we belong to the same family of administration in the health and family welfare. Your support is required henceforth. Thank you very much for all, everybody who has come and going to come. Of course, for any of our program in the COVID, many will come at the end to join the party for the inauguration. Many are not interested. Same face, same people, same report. Thank you very much, one and all, to everybody. And my family has supported me throughout here. My wife, Srimati Saraswati Sajjan, and also many have supported my Ksoga team from Manjula Patil, Bharati Rashekar, Durga Das, and EC member Shobha Malgi, Suman Gaddi, and Shobha Gudi, and one more, Sri Lakshmi. They all are yes, sir, DC, sir. My team is always yes. Nobody is known by name. But I never tell any work to them because that work is not sufficient to me, sir. So because of that, on behalf of that, I have carried a work with their blessings, with their support, with their willingness, what not, so many things. The similar support I request to everybody to support our young, dynamic, very academic Dr. Donimat. You have to support all. I am with them. If they don't support me, I can't help. And she is going to support me. I am having a lot of confidence that I will learn more. And another lady, very ambitious, foxy level, Vidya Thobbi madam, he is also eagerly waiting to take charge. But madam, you have to wait for a year to take charge. We will come there, we will grace, and she will also do the work. And another 2 young, Bharati Rashekar and Durga Das Sasrana, they are also young, dynamic, looking for the future. They are at the sky. They are dreaming so many things. Dear friends, all will have an opportunity. Come to Ksoga, support the program, scientific programs. Thank you very much, Manjula Patil, and everybody. Thank you. Thank you. Thank you very much.
Thank you, sir. There is a never moment which is dull when Dr. Basurat sir is speaking. Now we come to the primary event of the evening, the installation ceremony. I request the Chief Patron, Dr. M.G. Hiremat sir, to take over and perform the installation ceremony of the incoming President.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಮತ್ತೊಮ್ಮೆ ಸ್ವಾಗತ, ಸುಸ್ವಾಗತ. Chief guest of today's function, Honorable Deputy Commissioner Sri R. Girish sir, Guest of Honor Dr. Satish Kumar, DHO sir, dignitaries on the dais, Ksoga office bearers, Ksoga committee chairpersons, HASSAN members, today's speaker Dr. Pratap Kumar sir, and all the invitees. At the outset, I would like to thank the HASSAN Society for taking up this project of installing the new president and her team. As rightly told by our outgoing president, for last 2 years, we did not have any function like this to install because of the COVID pandemic. But when I requested Dr. Bharti, our Secretary General, being a Secretary General, you have to arrange this program in HASSAN, she readily agreed. Not only she readily agreed, she brought the best of the chief guest and guest of honor. Sir, Federation of Obstetrics and Gynecology India is more than 50 years old organization. It has got 280 member societies spread all over the India. And we have got more than 50,000 gynecologists who are into the service of the obstetrics and gynecology. 31 years back, we established the Karnataka chapter, Karnataka State Obstetrics and Gynecological Association, and we started with 8 member societies. Today I am happy to tell you that we have got 20 member societies. And during the tenure of Dr. Basura Sajjan, 4 more societies have been added. Now we have got 24 members. Sir, I know that Government of India and Government of Karnataka have got a vision to give the best of the health to the mother. As you know that mother is the pillar of the society and pillar of the family. If mother is healthy, everybody in the family is healthy. Sir, I promise on behalf of all the societies of Karnataka that we are at your disposal. At any moment you invite us to be a part of the government program, our all presidents and secretaries of local society will definitely come to your help. And we know that how the polio has been eradicated in our country. Rotary took a very big lead. In the same way, now we obstetricians and gynecologists are ready to help the government and ourselves also do the lot of social activities. And a word about HASSAN Society. I had come here long back, almost a decade back. Hardly there were some 12 to 15 members. Those 12 to 15 members organized a national conference at HASSAN. And for the last so many years, they are bagging every year the best prize at national level. Such a enthusiastic, great, the leaders are here. Kindly use their service to help the mothers to have the best of the health. And today being a very important day, installation of the new office bearers. Sir, we have got once in 2 years the main election, and as the president's tenure is only 1 year, only the president will be elected as a president-elect. Today, I request you to install our new dynamic, the member who has served the Ksoga in various capacities as EC member, treasurer, secretary. Today, she will be installed as president of Ksoga. And I request Dr. Basura Sajjan to transfer the chair and also the medal as a mark of transferring all the official authorities. Dr. Kasturi, you have to come to this chair where Dr. Sajjan is sitting. So it's a great moment. Please give a big clap, and I assure you on behalf of all the Ksoga members that we will be with you. We will be serving you with hand in hand to see that the mothers are healthy. I request chief guest of today's function, Dr. Sri R. Giri sir, to hand over the memento to the newly installed president, Sri R. Giri sir. Dr. Bharati, Honorary Secretary, can put a mala to her. Giri sir. Thank you very much. Dr. Kasturi, we wish you all the best on this day. To the best of your ability, please help the Ksoga in a big way. Kindly take the chair. Irli. Another post in our Ksoga is a president-elect, and these will be elected almost 3 months in advance. Dr. Vidya Thobi, Professor and HOD at Alamin Medical College, has been elected as the president-elect. I request her to come on to the dais, get installed by our guest of honor, Dr. Satish Kumar sir, DHO, HASSAN, and take the chair. I request Bharti to garland her. Thank you, Dr. Vidya, readily accepting the post, and we expect a lot from you because you do have many Foxy connections already, being a Foxy, the committee chairperson, and all other office bearers are going to continue for 1 more year. The EC members who will be changing next year. And I once again request all the Ksoga members to take a pledge that we will serve the women to our best. We will see that the women are healthy, and when they are healthy, everybody in the family is healthy, and reduce the maternal mortality. Sir, I am happy to inform you that the maternal mortality rate of India has come down a lot, but we have not yet reached the target. I think we have to reach the target, because any country progress is measured on the basis of maternal mortality and perinatal mortality. We will definitely assure you, sir, we will be with you to see that no mother will die with any disease, and every mother will be attended at a right time and in time, so that they will be healthy forever. With these few words, I once again congratulate all the new office bearers. I thank the organizers for giving me this opportunity, and I am doing this job for last 31 years. And yes, and way back, for the first time in Karnataka, there were no any academic programs at all. For the first time in 1986, our founder president Dr. A. Padmarao and Dr. Pratap Kumar, who is here, they organized a meet called as All Karnataka OBGYN meet. That was held in 86. In 87, the great late Dr. Sulochana Gunsila organized in Bangalore. 88 we could not organize because one of the greatest teacher the Karnataka has seen, Dr. S.N. Kaulgud, died in 1988 at Mysore. And we met in 1989, thought that we need a society, we need an organization to do, and today I am so happy, not only we have the organization, we have 20 committee chairpersons who are doing excellent job. Already Dr. Padmini Prasad name has come, and so many are here who have taken this challenge and they are doing so well. The Safe Motherhood Committee, Sonia, they are doing such a wonderful work. I think it will really be in a very big way in future, and we see a good future for this Ksoga. Thank you very much once again, and once again I thank you, all of you, for giving this opportunity. Thank you. One more, we would like to honor our outgoing president, Dr. Basavaraj Sajjan. I request Dr. Bharti Rasekar to honor the most humorous president I have seen in the last 31 years. I think he has got this humor which has made him successful. So to become a successful person, only academics is not enough. We need many more qualities. I think this quality of him has made him a very, very popular president, and during his tenure, he has done excellent work. and he has taken the Ksoga to a greater height. And in the incoming years, I expect the new committees also to do. And I would like to thank Dr. Bharati Rasekar, who has become a part and parcel of Ksoga for such a long time. And when we selected and elected Bharati, they said Bharati is very difficult to get because he is always in foreign. Thanks to COVID, which made her not to go to foreign, she remained India only. She started doing lot of academic activities. I request her, because her tenure is 1 more year, not to go to foreign for next 1 year. Be here only, do many more academics. Thank you very much.
Thank you, sir. Now I request today's chief guest, Shri Girish R, to speak a few words for us, sir. Please, sir.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Good evening to all of you. It's my pleasure to be here today on the occasion of installation of new President of Karnataka State Obstetrics and Gynecology Association. Dr. Bharati came to me and invited few days back. So I thought I should not miss this opportunity to be with doctors, that too the doctors of your category. All of you know that the birth of child is very important, and at the time of the child is born and mother is reborn. So people say that delivering a child is a rebirth to the mother. The process is so complicated, and we have seen many times the death of the mother itself. So maternal mortality rate is one of the very crucial things which we monitor. So there is a committee under the chairmanship of DC wherein we analyze each death and cause of each death of a mother, and also IMR also we study. So in fact, after I came here, I made Dr. Bharati as a member of my committee, because I am not a doctor. I should listen to what my DHO says. DHO always says in favor of his staff. So I wanted somebody else to analyze the cases and find out what is the real cause for death and take some corrective action. And it's not with the intention to punish somebody. It is to initiate the right action so that they are not repeated in future. I would like to congratulate this fraternity because the achievement is immense. At the time of the independence, MMR was about 2,000 deaths per 1 lakh live births. So now it has come down almost to 100. So last 4-5 years we are at 100, 150. I think our national policy has targeted 100, and it is one of the very important crucial factors. Even United Nations Sustainable Development Goals has also set MMR around 60 to 70. Many of the, I was very happy to learn that more than 3-4 states in our country have already achieved that sustainable development goal. And Karnataka is almost nearing. We have achieved the national goal of 100 MMR. So, and I think we are hopeful of achieving the desired target. And health department, I should appreciate that they do a lot of work. So they start tracking, all of you know, they start tracking a woman when she gets pregnant. So there are different stages over the period of 9 months, minimum 2 anomaly scans needs to happen. High risk pregnancies are identified, and they are brought to the hospital whenever it is required. So all these things are done in a very systematic way, and there is a robust IT system which is in place through which we can track each mother and child. I am very happy to say that more than 98% is institutional delivery. 99 or 99 normally? institutional delivery. 99.5 is the institutional delivery. So, institutional deliveries are the reason for which there is a very less MMR, because they get medical attention at right time, so that MMR is reduced. The credit of this achievement, so 2000 MMR to 100 MMR goes to all of you. It is because of your efforts, and if it is because of your tireless work what you do throughout the round the clock, because sometimes you may have to go in the night also to make some deliveries and other things, and you have been a part of such a beautiful job where all of us will really feel proud of the work done by this category of doctors. And one thing I would like to say, my first baby costed me only 9,600 rupees. Second baby costed me 50,000 rupees. And now I heard that the babies are costing 2 lakhs and 3 lakhs. It is very expensive to have a baby now. So you can, it's also lucrative. Job of a doctor is also lucrative. At the same time comes with a enormous responsibility, and you have to constantly upgrade your skills. And newer and newer inventions are taking place, and you should keep abreast with the latest developments in the field, so that the best of the services can be provided to the last person in the society. Once again, I will thank all of you for choosing HASSAN to do this installation ceremony, and also to Dr. Bharti Rajshekar, who has taken a lot of initiatives to make this program such a beautiful program. Dr. Hiremat was telling that they want to associate with the government. So at the district level, not only me, all DCs would be rather very happy to associate with any of these associations of the doctors, because we want to take the best health facility to the poorest of the poor person. And there has been a very large scale infrastructure development in the health sector. Even in Hobli level, we have got community health centers. In HASSAN, we have got around 13 community health centers, and all of them are equipped with oxygen pipeline because of COVID and other things. Lastly, and I was very impressed by the speech of Dr. Basuraj Sajjan. I am with Dr. Sajjan. He should have given 1 more year of extension, because of COVID year should not be considered. He should have continued as president for 1 more year. I hope he will get another chance to lead this organization. I thank on behalf of all of you, and personally for his contribution during the toughest periods as the president of Karnataka KSOGA. And I also thank and wish all the best to the new president who has taken charge today, Dr. Kasturi Donimat. Under her leadership, the organization, I wish the organization should reach new heights and should take up more and more programs. In fact, I think it is Dr. Bharti who gave me some request to vaccination for cervical cancer. So cervical cancer is one which is not picking up, and the government has also not taken so seriously as we have taken other diseases and this thing. I think in the coming days, government would certainly consider that, and it's very, very crucial to see that cervical cancer is also treated, and vaccination is done to prevent it. Once again, I thank all the doctors who are here. All the best in their future and their life. Enjoy HASSAN, visit Belur and Halebid, go to some resort where you have beautiful coffee estates. Those who are particularly come from north, HASSAN is a nice place. As the doctor was telling, it is a poor man's Ooty. So weather will be like this. But don't think it is a poor man's Ooty. You should spend more to go to a resort. It is no more poor man's Ooty. It is an expensive Ooty only. But it is really a beautiful Ooty. So once again, I thank all of you and wish all the best to all the doctors who are here. Thank you.
Thank you so much, sir. Now I call upon Dr. Kasturi Donimat, Madam, President Ksoga, to address us.
Slides. I wanted to show the slides. Laptop.
I would like to call Dr. Satish Kumar, our DHO, to please speak to us for a few minutes. Madam, we'll proceed with the book release. I request Dr. Hemalata to please come on the dais. Madam. This is a special event of this evening. Our very own senior member, Dr. Hemalata, has penned booklets on menstrual health and breast cancer awareness and prevention. I request Dr. Satish Kumar sir to formally release the booklets. Booklets on menstrual health and breast cancer awareness and prevention. Dr. Savitri had also written an excellent book on breastfeeding, which was released in the Ksoga annual meet. It was the first book released by Ksoga, book on breastfeeding. Dr. Satish Kumar sir to address us.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ವೇದಿಕೆ ಮೇಲೆ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಿರುವ ಮಾನ್ಯ ಜಿಲ್ಲಾಧಿಕಾರಿಗಳೇ, ಜೊತೆಗೆ ಈ ಒಂದು ಆಬ್ಸ್ಟೆಟಿಕ್ಸ್ ಸಂಘದ ಎಲ್ಲ ಪದಾಧಿಕಾರಿಗಳೇ, ಎಲ್ಲ ವೈದ್ಯ ಮಿತ್ರರೇ, ಈಗಾಗಲೇ ನಾವೆಲ್ಲ ನೋಡಿದ್ದೇವೆ. ನಮ್ಮ ಹಾಸನಗೆ ಸಂಬಂಧಪಟ್ಟಂತೆ ಹೇಳಬೇಕಂದ್ರೆ ಈಗಾಗಲೇ ಕೋವಿಡ್ ಸಂದರ್ಭದಲ್ಲೂ ಕೂಡ ನಮಗೆ ಅತ್ಯಂತ ಹೆಚ್ಚು ಸಹಕಾರ ಕೊಟ್ಟಂಥದ್ದು ನಮ್ಮ ಜಿಲ್ಲೆಯ ಎಲ್ಲ ಶ್ರೀರೋಗ ತಜ್ಞರು ಮತ್ತು ಇವರ ಸಹಕಾರದಿಂದ ನಮ್ಮಲ್ಲಿ ಏನು ಈ ಸಂದರ್ಭದಲ್ಲಿ ಪ್ರೆಗ್ನೆಂಟ್ ವುಮನ್ಸಲ್ಲಿ ಮತ್ತು ಡೆಲಿವರಿ ಸಂದರ್ಭದಲ್ಲಿ ಡೆತ್ಸ್ ಆಗ್ತಾಯಿತ್ತು, ಏನು ನಿಮೋನಿಯಾ, ಕೋವಿಡ್ ನಿಮೋನಿಯಾ ಆಗಿ ಅದನ್ನು ನಾವು ಏನು ಕಡಿಮೆ ಮಾಡೋದಕ್ಕೆ ಸಾಧ್ಯ ಆಗಿದ್ದಂಥದ್ದು ನಮ್ಮ ಇಲ್ಲಿನ ಎಲ್ಲ ನಮ್ಮ ಗೈನಕಾಲಜಿಸ್ಟ್ ಅವರ ಸಹಕಾರದೊಂದಿಗೆ. ಸೊ ಜಿಲ್ಲೆಯಲ್ಲಿ ಇವತ್ತು ಕೂಡ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ ಡೆಲಿವರೀಸು ನಮ್ಮದು 99.9% ಇದೆ. ಒಂದು ಟ್ರಾನ್ಸಿಟಲ್ಲಿ ಒಂದು ಡೆಲಿವರಿ ಆಗಿದ್ದು ಬಿಟ್ಟರೆ ಬೇರೆ ಯಾವುದೂ ಕೂಡ ಹೋಮ್ ಡೆಲಿವರೀಸ್ ಆಗಿಲ್ಲ. ಅದನ್ನು ಬಿಟ್ಟರೆ ಇನ್ಯಾವುದೂ ಕೂಡ ನಮ್ಮಲ್ಲಿ 100% ಇವತ್ತು ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ ಡೆಲಿವರೀಸ್ ಆಗ್ತಾಯಿದೆ. ಜೊತೆಗೆ ನಮ್ಮಲ್ಲಿ IMR ಕೂಡ ಬೇರೆ ಸ್ಟೇಟ್ಗೆ ಕಂಪೇರ್ ಮಾಡಿದಂಥ ಸಂದರ್ಭದಲ್ಲಿ ನಮ್ಮ ಜಿಲ್ಲೆಯಲ್ಲಿ 18 ಇದೆ IMR. ಜೊತೆಗೆ MMR ಕೂಡ ವಿ ಆರ್ ರೀಚ್ಡ್ 60 per 1 lakh ಲೈವ್ ಬರ್ಸ್. ಸೊ ಈ ಸಂದರ್ಭದಲ್ಲಿ ನಾವೆಲ್ಲ ನಮ್ಮ ಜೊತೆಗೆ ಎಲ್ಲ ನಮ್ಮ ನ್ಯಾಷನಲ್ ಪ್ರೋಗ್ರಾಮ್ಸ್ಗೆ ಏನು ನಿಮ್ಮ ಒಂದು KSOG ಸಂಘ ಏನಿದೆ ಅದು ಯಾವಾಗಲೂ ಕೂಡ ನಮ್ಮ ಜೊತೆ ಇರ್ತದೆ. ಜೊತೆಗೆ ಇಲ್ಲಿರೋ ಎಲ್ಲ ಹಿರಿಯ ವೈದ್ಯರು ಕೂಡ ನಮ್ಮ ಜೊತೆ ನಮ್ಮ ಜಿಲ್ಲಾಡಳಿತ ಜೊತೆ ಸಹಕಾರ ಕೊಡ್ತಾ ಇದ್ದಾರೆ ಅಂತ ಹೇಳ್ತಾ ಅವರೆಲ್ಲರಿಗೂ ಕೂಡ ಈ ಸಂದರ್ಭದಲ್ಲಿ ಅಭಿನಂದನೆ ಸಲ್ಲಿಸ್ತಾ ನಾನು 2 ಮಾತು ಮುಗಿಸ್ತೇನೆ. ನಮಸ್ಕಾರ.
I thank our DC, Shri Girish R, who has come here to be with us in spite of his busy schedule. I thank you very much, sir. I request Dr. Basaraj Sajjan sir and Dr. Hirimat sir to felicitate. Thanks to Dr. Satish Kumar sir for always cooperating with us and always involved in our activities. Thank you, sir. Request Dr. Hemalata ma'am to speak a few words about her experience in writing the booklet and her thought process.
ಎಲ್ಲರಿಗೂ ಇಂದಿನ ಸುಂದರ ಸಂಜೆಯ ಶುಭಾಶಯಗಳು. ಇಂದಿನ ಸಮಾರಂಭದ ಮುಖ್ಯ ಅತಿಥಿಗಳಾದ ಡೆಪ್ಯೂಟಿ ಕಮಿಷನರ್ ಮಾನ್ಯ ಶ್ರೀ ಗಿರೀಶ್ ರವರು ಈಗ ತಾನೇ ಹೋದರು, ಹಾಗೂ ಗೌರವಾನ್ವಿತ ಅತಿಥಿಗಳಾದ DHO ಸತೀಶ್ ಸರ್ ಅವರು ಕೂಡ ಈಗಾಗಲೇ ನಿರ್ಗಮಿಸಿದ್ರು. ವೇದಿಕೆಯ ಮೇಲಿರುವ KSOG ಸಂಸ್ಥೆಯ ಗಣ್ಯ ಪದಾಧಿಕಾರಿಗಳೇ, ನನ್ನ ಹಿರಿಯ ಕಿರಿಯ ಸಹೋದ್ಯೋಗಿಗಳೇ ಮತ್ತು ಮಿತ್ರರೇ, ನಿಮ್ಮೆಲ್ಲರಿಗೂ ನನ್ನ ವಿಶೇಷವಾದ ವಂದನೆಗಳು. ಮೊದಲಿಗೆ ಈ ಪುಸ್ತಕ ಬಿಡುಗಡೆಯ ಕಾರ್ಯಕ್ರಮವನ್ನು ಏರ್ಪಡಿಸಿದ KSOG ಸಂಸ್ಥೆಯ ಕಾರ್ಯದರ್ಶಿ ಡಾಕ್ಟರ್ ಭಾರತಿ ರಾಜಶೇಖರ್, HSOG ಸಂಸ್ಥೆಯ ಅಧ್ಯಕ್ಷೆ ಡಾಕ್ಟರ್ ಸಾವಿತ್ರಿ, ಇತರ ಪದಾಧಿಕಾರಿಗಳು ಮತ್ತು HSOG ಸಂಸ್ಥೆಯ ಇತರ ಸದಸ್ಯರು, ಇವರಿಗೆಲ್ಲ ನನ್ನ ಆತ್ಮೀಯ ಕೃತಜ್ಞತೆಗಳು. ಕೋವಿಡ್ ಸಮಯದಲ್ಲಿ ನನಗೆ ತುಂಬ ಬಿಡುವಿರ್ತಾ ಇತ್ತು. ಈ ಬಿಡುವಿನ ಸಮಯನ ಹೇಗೆ ಉಪಯುಕ್ತವಾಗಿ ಕಳಿಬೇಕು ಅನ್ನೋ ಆಲೋಚನೆ ನನ್ನನ್ನು ಸದಾ ಕಾಡ್ತಾ ಇತ್ತು. ಕಾಕತಾಳೀಯವೆಂಬಂತೆ ನಮ್ಮ HSOG ಸಂಸ್ಥೆಯ ಸುಯೋಗವೆಂಬಂತೆ ಡಾಕ್ಟರ್ ಭಾರತಿ ರಾಜಶೇಖರ್ ಅವರು KSOG ಸಂಸ್ಥೆಯ ಕಾರ್ಯದರ್ಶಿಯಾಗಿ ಚುನಾಯಿತರಾದರು. ಹಾಗೂ ಅತ್ಯಂತ ಸೂಕ್ತ ವ್ಯಕ್ತಿಯಾದ ಡಾಕ್ಟರ್ ಸಾವಿತ್ರಿ ಲಕ್ಷ್ಮೀಕಾಂತ್ ಅವರು ಜನಜಾಗೃತಿ ಸಮಿತಿಯ ಅಧ್ಯಕ್ಷರಾಗಿ ನೇಮಕಗೊಂಡರು. ಸಾವಿತ್ರಿ ಲಕ್ಷ್ಮೀಕಾಂತ್ ಅವರು ಅವರ ಜನಪರ ಕಾರ್ಯಗಳಿಗೆ ಹಾಗೂ ಲೆಕ್ಕ ಇಲ್ಲದಷ್ಟು ಆರೋಗ್ಯ ಶಿಬಿರಗಳು, ಸಂಘ ಸಂಸ್ಥೆಗಳಲ್ಲಿ, ಶಾಲಾ ಕಾಲೇಜುಗಳಲ್ಲಿ ಅವರು ಹಮ್ಮಿಕೊಂಡಿರುವ ಆರೋಗ್ಯ ಕಾರ್ಯಕ್ರಮಗಳಿಗೆ ಲೆಕ್ಕನೇ ಇಲ್ಲ. ಇನ್ಫ್ಯಾಕ್ಟ್ ನ್ಯಾಷನಲ್ ಲೆವೆಲ್ನಲ್ಲಿ ಅವರು ಈ ಪದವಿನ ಅಲಂಕರಿಸಿದ್ರೆ ಅದು ಅತ್ಯಂತ ಸೂಕ್ತ ಅಂತ ನನ್ನ ಅಭಿಪ್ರಾಯ. ಅದು ನನ್ನ ಹಾರೈಕೆ ಕೂಡ. ಹೀಗೆ ಡಾಕ್ಟ್ರು ಭಾರತಿ ರಾಜಶೇಖರ್ ಅವರು KSOG ಸಂಸ್ಥೆಯ ಕಾರ್ಯದರ್ಶಿ ಆದಮೇಲೆ ಮಹಿಳೆಯರಲ್ಲಿ ನಮ್ಮ ಸಾಮಾನ್ಯ ಜನರಲ್ಲಿ ಅರಿವು ಮೂಡಿಸೋಕ್ಕೋಸ್ಕರ ಕನ್ನಡದಲ್ಲಿ ಲೇಖನಗಳು ಬರೀರಿ ಅಂತ ಪ್ರೇರೇಪಿಸಿದ್ರು. ಜೊತೆಗೆ ತುಂಬ ಅಗತ್ಯವಾದ ಪರಿಪೂರ್ಣವಾದ ಮಾಹಿತಿಗಳನ್ನ ನೀಡಿದ್ರು. ಇದರಿಂದ ನಾನು ಪುಸ್ತಕನ ರೂಪುಗೊಳ್ಳಕ್ಕಾಯಿತು. ಈ ಪುಸ್ತಕ ರೂಪುಗೊಳ್ಳುವ ಸಮಯದಲ್ಲಿ ನನಗೆ ನನ್ನ ಮೆಚ್ಚಿನ ಕಿರಿಯ ಸಹೋದ್ಯೋಗಿ ಪ್ರತಿಭಾರವರು ಅತ್ಯಂತ ಉಪಯುಕ್ತ ಸಲಹೆಗಳನ್ನ ನೀಡಿದ್ದಾರೆ. ಹಾಗೆ ಫೈನಲ್ ಆಗಿ ಪುಸ್ತಕ ಪ್ರಕಟಣೆಗೊಳ್ಳಕ್ಕೆ ಡಾಕ್ಟ್ರು ಸಾವಿತ್ರಿ ಲಕ್ಷ್ಮೀಕಾಂತ್ ಅವರು ಪ್ರತಿ ಹಂತದಲ್ಲೂ ಸಹಕರಿಸಿ ಉತ್ತೇಜನ ಕೊಟ್ಟಿದ್ದಾರೆ. ಇವರುಗಳಿಗೆಲ್ಲ ನಾನು ಅತ್ಯಂತ ಚಿರಋಣಿಯಾಗಿದ್ದೇನೆ. ಇನ್ನು ನಮ್ಮ HSOG ಸಂಸ್ಥೆಯ ಬಗ್ಗೆ ಹೇಳಬೇಕು ಅಂದರೆ, ನಮ್ಮ HSOG ಸಂಸ್ಥೆಯ ಸದಸ್ಯರೆಲ್ಲರೂ ಈ HSOG ಸಂಸ್ಥೆಯು ಉತ್ತಮ ಲೇಖಕಿಯರ ಕಣಜ ಅಂದರೆ ಖಂಡಿತ ಅತಿಶಯೋಕ್ತಿಯಾಗಲಾರ್ದು. ದಿನಪತ್ರಿಕೆಗಳು, ರೇಡಿಯೋ, TV ಕಾರ್ಯಕ್ರಮ, ಹೀಗೆ ಎಲ್ಲ ಪ್ರಸಾರ ಮಾಧ್ಯಮಗಳ ಮೂಲಕ ಶಾಲಾ ಕಾಲೇಜುಗಳಲ್ಲಿ, ಸಂಘ ಸಂಸ್ಥೆಗಳಲ್ಲಿ, ಹಳ್ಳಿ ತಾಲೂಕುಗಳಲ್ಲಿ ಶಿಬಿರಗಳು ನಡೀತಾನೇ ಇರುತ್ತೆ. ಹಾಗೂ ಆರೋಗ್ಯಪರ ಕಾರ್ಯಕ್ರಮಗಳು ಕೂಡ ನಡೀತಾ ಇರುತ್ತೆ. ಎಲ್ಲರೂ ನಮ್ಮ HSOG ಸಂಸ್ಥೆಯ ಸದಸ್ಯರೆಲ್ಲ ಸಾವಿತ್ರಿಯ ಜೊತೆಗೂಡಿ ಸಕ್ರಿಯವಾಗಿ ಪಾಲ್ಗೊಂಡು ಎಲ್ಲ ಕಾರ್ಯಕ್ರಮಗಳು ಅತ್ಯಂತ ಯಶಸ್ವಿಯಾಗ ಹಾಗೆ ನೋಡ್ಕೊಳ್ತಾರೆ. ಅವರೆಲ್ಲರಿಗೂ ನನ್ನ ಕೃತಜ್ಞತೆಗಳು. ಕಡೆಯದಾಗಿ ಈ ಸಂಸ್ಥೆಯ ಸದಸ್ಯೆಯಾಗಿ ಮಹಿಳೆಯರಲ್ಲಿ ಅರಿವು ಮೂಡಿಸಲು ಈ ಪುಸ್ತಕ ನಾನು ಬರೆದಿರೋದು ಒಂದು ಕಿರು ಪ್ರಯತ್ನ. ನಾನು ನನ್ನ ಈ ಪುಸ್ತಕ ಪ್ರಕಟಣೆಗೆ ಟೈಪಿಂಗ್ ಪ್ರಕ್ರಿಯೆಯಲ್ಲಿ ಮತ್ತು ಪ್ರಿಂಟ್ ಆಗಬೇಕಾದ್ರೆ ಸಹಕರಿಸಿದ ಎಲ್ಲರೂ ದಯವಿಟ್ಟು ವೇದಿಕೆ ಮೇಲೆ ಬರಬೇಕಾಗಿ ಕೇಳ್ಕೊಳ್ತೀನಿ. ಹರ್ಷ ಹೊಸಮನೆಯವರು, ಆಮೇಲೆ ಪ್ರಶಾಂತ್ ಇಂಡೋಸ್ಪೆಕ್ಟ್ರಮ್, ಆಮೇಲೆ ಟೈಪಿಂಗಲ್ಲಿ ತುಂಬ ಸಹಕರಿಸಿದ ಭಾರತಿ, ಪೂರ್ಣಿಮಾ ಹಾಗೂ ಜಯಶ್ರೀ ನರ್ಸಿಂಗ್ ಹೋಮ್ ಸಿಬ್ಬಂದಿ ವರ್ಗ, ಇವರೆಲ್ಲರೂ ವೇದಿಕೆ ಮೇಲೆ ಬಂದರೆ ನಮ್ಗೆ ತುಂಬ ಸಂತೋಷ ಆಗುತ್ತೆ.
ಸನ್ಮಾನ ಮಾಡ್ತೇವೆ, ಅವರು ಬರಲಿ. ಡಾಕ್ಟರ್ ಸಾವಿತ್ರಿ ಅವರು.
I invite Dr. Savitri madam and Dr. Hemalata madam onto the dais. We would like to felicitate you, madam.
ಈ ಸಂದರ್ಭದಲ್ಲಿ ಈ ಹಿಂದೆ ಪುಸ್ತಕವನ್ನು ಬರೆದು ಎಲ್ಲ ಕಸೋಗ ಸದಸ್ಯರಿಂದ ಮೆಚ್ಚುಗೆ ಪಡೆದಂಥ ಡಾಕ್ಟರ್ ಸಾವಿತ್ರಿ ಅವರು ವೇದಿಕೆ ಮೇಲೆ ಕೂಡಬೇಕು. ಈ ಒಂದು ವಾರದ ಹಿಂದೆ ನಾನು ಸಾವಿತ್ರಿ ಮೇಡಮ್ ಅವರಿಗೆ ಫೋನ್ ಮಾಡಿದೆ ಕಸೋಗ ಆಫೀಸ್ಲಿಂದ. ಮೇಡಮ್, ಆ ಪುಸ್ತಕದ ಖರ್ಚು ನಾವು ಕಸೋಗ ಸಂಸ್ಥೆಯಿಂದ ಕೊಡ್ತೇವೆ, ಅದಕ್ಕೆ ತಾವು ಒಪ್ಪಿಗೆ ಕೊಡಬೇಕಂತ. ಸುಮಾರು 52,000 ರೂಪಾಯಿ ಆಗಿದೆ. 1,000 ಪ್ರತಿಗಳನ್ನು ಅವರು ಪ್ರಿಂಟ್ ಮಾಡಿ ಪ್ರತಿಯೊಬ್ಬ ಕಸೋಗ ಸದಸ್ಯರಿಗೆ ಕೊಟ್ಟಿದ್ದಾರೆ. ಅವರು ಇಲ್ಲ ಸರ್, ನನಗೆ ಏನು ಹಣ ಬೇಕಾಗಿಲ್ಲ, ನಾನು ಇದನ್ನು ನನ್ನ ಅತ್ಯಂತ ಪ್ರೀತಿಯಿಂದ ಎಲ್ಲ ನನ್ನ ವೈದ್ಯ ಮಿತ್ರರಿಗೆ ಮುಟ್ಟಬೇಕು ಅನ್ನೋ ಉದ್ದೇಶದಿಂದ ನಾನು ಬರೆದು ಪ್ರಿಂಟ್ ಮಾಡಿದ್ದೇನೆ ಅಂತ ಹೇಳಿದ್ದಾರೆ. ಅದಕ್ಕೆ ಕಸೋಗ ವತಿಯಿಂದ ಅವರಿಗೆ ತುಂಬ ಧನ್ಯವಾದಗಳು.
Dignitary. Now I request Dr. Kasturi Donimat Madam, President Ksoga, to address the gathering.
Okay. A pleasant evening to one and all assembled here. Respected dignitaries on the dais, today's chief guest, Girish Kumar, DC HASSAN, DHO Satish Kumar, Dr. Satish Kumar, DHO HASSAN, our patron, chief patron, Dr. MJ Remat sir, President Dr. Sajjan sir, immediate past president. Okay, sir. Okay, sir. President Sajjan sir. Then Secretary General Dr. Bharti Rashekar, Treasurer Dr. Durga Das, HASSAN Society President Dr. Savitri, Secretary Dr. Babita, and the past presidents, Dr. Amrish Bandivat sir, Dr. Pratap Kumar sir, all the EC members, Dr. Shobha Bambargi, Suman Gaddi, Dr. Shobha Gudi, and Dr. Sri Lakshmi, and President-elect, not able to see Vidya, Dr. Vidya Tobbi, President-elect 2022, and I can see many dignitaries of the dais who have come all the way traveling. Dr. Padmini Prasad Madam, Dr. Madhu, Dr. Rajalakshmi, Sonia, Dr. Sonia Mandapa, and many more faculties, Ksoga presidents, secretaries who have traveled all the way from the state to come here for this installation ceremony. And my good friends, Dr. Sudha, and many more. So this is a real moment of proud and privilege for me to stand before you as president of this very prestigious organization, Karnataka State OBG Society. Before I start my speech, before I highlight upon the activities for the year 2022-23, I sincerely and humbly bow down to my parents and my in-laws, who are 92 years old now, who have done an excellent upbringing, who have encouraged me, supported me, and inspired me so that I am on this stage before you as President of Ksoga. Ksoga, as all of you know, was established almost 36 years back in 1986 with the founder president Dr. Padma Rao, Professor Emeritus at KMC Manipal, and founder secretary none other than our MJ Remat sir. Big round of applause to sir. Since 36 years he is on this platform. Ksoga has come a long way since then, and it is growing heights and highs day by day. The aims and objectives of Ksoga to provide a forum for the professional interaction with our OBG friends, to support and promote welfare of all the practitioners of OBGYN, to maintain efficient standards of teaching, enhance standard of practice of OBGYN, and promote research in a field. I am standing before you only because of the guidance, mentorship, and support of all the Ksoga office bearers since years, but presently, the year 2021, my humble pranams to Dr. MG Remat sir, Chief Patron of Ksoga, the founder pillar, the central pillar I call him, who has held the flag of Ksoga so high since last 36 years. Can you imagine? Big round of applause to sir. Sir has encouraged all the young ones. He's my teacher, he's my mentor. I always look up to him. He's my inspiration. And I've entered Ksoga only because of MJ Remat sir. I owe all my whatever posts I've held, everything. I am very much grateful to you, sir, and always ever grateful to you for whatever you have done to me. I'll never forget in my life the support you have extended to me. It's my, please accept my pranams. Actually, in the whole Karnataka, Ksoga means MJ Remat sir. That's the equivalent. I extend my pranams to Dr. Basuraj Sajjan, President 2021-22. Sir, I know he took charge during COVID. He came to Hubli when he was taking charge. I think he and Donimat sir, only three of us sitting in front of the laptop, and it was online taking charge, so I hope sir remembers that. And so the charge was taken by sir during COVID. As sir tells COVID president, yes, throughout the year he had to face lots of hurdles due to first wave, second wave, third wave, whatever. Throughout there was COVID, and there were lots of restrictions, so no offline events could occur, but what an excellent job he has done, excellent. So many initiatives during the last year. Ksoga KCOG initiative, the first time in India any association has come with a College of Obstetrician and Gynecology, Ksoga KCOG initiative. They have formed more than 20 committees. All committees which are in FOXI are in Ksoga. You take Family Welfare Committee, Safe Motherhood, High Risk Infertility Committee, Oncology Committee, every Adolescent Committee, everything is there in Ksoga. And also, he went from pillar to post. He went to each society in Koppal, Karwar, and here Madikeri, Kodagu. So, added up 4 societies to the Ksoga. In a year, it's tremendous job to add 4 societies, because to one society to get affiliated to Ksoga, it takes so much of time and energy. But personally, I've seen him going personally to all these societies, encouraging the members and increasing the number of members and encouraging them to get affiliated to Ksoga. And also, what I remember about Sajjan sir is, in spite of COVID, they did hundreds of webinars, he did. And also, though there was so much of uncertainty, so much of question mark regarding how the conference, state conference will be conducted. Initially, it was planned for offline. Then they told, no, it is going to get cancelled. And then I remember he going personally and meeting the DC and taking permission and to do it as hybrid, both offline and online. Dr. Madhu from Davangere is here, who has worked a lot. So it is not an easy job to do it hybrid. I know how difficult it is to do a thing hybrid. And in spite of so many hurdles, in spite of so many question marks, he did a tremendous, very excellent conference in Davangere. A big round of applause to our outgoing president, Dr. Sajjan sir. He has taken the name of flag of Ksoga so high. He has set the standards high. I hope I stand up to those and take it to more heights. Thank you, sir, for all the support. And we want your support always.
I am always supporting you.
Okay, sir. Thank you so much. And our patron, Dr. H. Nagaraj, because of some personal commitments, he couldn't make it today, but he has sent a personal message. He had called up me in the morning 2 times. And then he has extended his blessings and best wishes to me. Thank you, Nagaraj sir, for all that. He is again very good in all the rules, regulations. He knows clear-cut everything, and he guides us. Any time of the day I call him, he's ready to help. We always call him Bhishma Pitama of Ksoga. Thank you, sir, for all your best wishes, blessings. Looking forward for your support all the time. Now we have Dr. Bharti, very dynamic, vibrant secretary. She's not just into Ksoga, she's into many fields. Today only she was installed in some Samaja Kalyan, this thing. So you name anything in HASSAN, Bharti is there. You name anything. So I remember about Bharti is when I was the president of Hubli Dharwad Obesity Society long back. We had a satellite conference. You know, satellite. That was the first time a satellite conference was conducted through Foxy, and it was done by HASSAN Society. That's why the time I came to know about Dr. Bharti. Excellent, one of the best satellite conference. Now we have so many webinars online, we can plan half an hour before and it's, but for that was because it was the first time in India, they had to plan so much. And I also remember Bharti and Dr. Soumya doing the excellent state conference of 2010. Yes, excellent. I still remember each and every moment we spent on HASSAN State Conference, excellent job. So with Bharti as my secretary, I'm sure we are going to do lots of activities and take Ksoga to new heights. Now we have our very, very efficient treasurer, Dr. Durga Das, very close to me since many years. He is our alumni, I know him since years. And without him, Ksoga cannot run. He is the main treasurer. So, and a very planned, meticulous person, very to the mark, and his ideas are very innovative and very clear-cut ideas. With him as a treasurer, I think Ksoga is going to become more richer. Hope to hand over to the next Vidya with a more richer Ksoga. Definitely, with Durga Das as the treasurer, yes, I'm sure we are going to be more vibrant Ksoga society. Thank you, Dr. Durga sir. And Dr. Shobna Patel, immediate past president, yes, she wanted to come for this installation, but some emergency, this thing, she couldn't make it, but she has called me and she has sent a message, she has personally called and she told me, Even if I'm not there personally as in person, but my heart and soul is here on the stage with you, she told. She has extended these words, she has written and sent and told me that her heart and soul is with me here when I'm taking over as president of Ksoga. I worked as secretary when Shobna was president of this association. Very disciplined person, very meticulous, very clear-cut ideas, and she has done such a good work to Ksoga. It cannot be expressed in words. What an excellent work she had done. And as I'm working as a secretary, I've learnt a lot. I always look up to her. Anything I want, I call her because she is so perfect in all the rules and regulations and all. So I always look up to you, madam. I seek your blessings. I seek your guidance. I seek your mentorship throughout my tenure. I wish you were there on that HASSAN during my installation. Thank you, Shobna, madam. And I immensely thank all the EC members who have traveled all the way from Karnataka. Dr. Suman Gaddi, yes, she has traveled all the way from Ballari. She has made it. She should be in HASSAN. I think she was the first one who put it in the group that, yes, I'm coming with sir. And that inspired me to come with my best half. Dr. Suman, yes, again, I can remember very dynamic person, excellent work. I can remember Suman's because to give the way they conducted a state conference in Ballari, excellent job. Actually, to give a conference to Ballari, we were thinking twice because it's a government college, whether to give it or not. But they took up, Suman took it as a challenge, and an excellent conference, one which we can remember always. Yes, Suman, thanks to you and for all your support, and we are seeking for your support always, Suman. Yes. And another good friend of mine, Dr. Shobha Membalgi, very, very close friend. We are like one family, myself and Shobha. Anything I do, Shobha is always there by my side. Her moral support, her encouragement, anything of any time of the day, I just call her up, Shobha is there by my side. We don't work like two people, we work like one people, myself and Shobha. Shobha is always there for me, and we are having a state conference, and we were planning to do many more activities throughout during this tenure along with Shobha. Thank you, Shobha, for being with me always. And Dr. Shobha Gudi, yes, another very vibrant, dynamic personality. I need not talk about Dr. Shobha Gudi because the number of webinars and the number of these things she has conducted as a Family Welfare Committee of Chairman of Foxy, the number of work she has done that speaks, I need not speak in words, whatever she has done, it speaks in plenty, what Dr. Shobha Gudi has done. I always telling Shobha, the amount of work you have done as a Family Welfare Committee of Foxy, I am sure one day what Dr. Narendra Modi is planning, that stabilization of population, directly or indirectly, you are the cause for stabilization of population with the awareness you are creating in the society. Thank you, Shobha. Looking forward for excellent support during my tenure. And Dr. Sri Lakshmi has also expressed that she is unable to come because one of her relatives is admitted. She had actually traveling morning, but she had to cancel it but she has sent the best wishes to us. Thank you, Sri Lakshmi. Dr. Manjula Patil, again a very vibrant, dynamic, yes, I can see, beautiful, smart, ever well-dressed, and always as a website coordinator. And during her webinar, the website was so updated, so beautiful. Everybody should go through the Ksoga website. It is really very this thing. Thank you, Manjula, and seeking for your support always. And Dr. Vidya Tobi, where is Vidya? Yeah, after 5 minutes, I have to update this. Dr. Vidya, President-elect, she is with me always, and Vidya and me are like planning to do many more activities. And Vidya, you all know, I did not tell anything because shortage of time, I have to cut my words. Thank you, Vidya, waiting for you. And all the co-opted members, Shukla Shetty, Prema Prabhudev, and Shobha Dhananjay, and all of the Ksoga past presidents who have traveled all the way. Dr. Pushpa Srinivas, she has sent blessings and messages to me. Hema Devakar Madam, again, she has sent blessings and messages morning. Pratap Kumar sir, all the way has traveled from Manipal, will be speaking the next. So thank you, sir, for taking time to be there during my installation. Thank you, and seeking your blessings and support always. B.R. Desai, sir, Ambrish Bandiwar, sir, specially has come from Mysore. He told, I'm going to be there for installation. So thank you, sir, for being there and seeking your blessings and support always. Dr. H. Nagaraj, Dr. Vidya Bhatt, yes, thank you, Vidya, madam, for your blessings. Dr. M.B. Bellad, another past president with whom when he was a president, I was secretary. Again, a very innovative brain, very innovative ideas, excellent work during his tenure, and I have learned a lot. I'm always looking forward for his innovative ideas, and he comes up with so many ideas. During his tenure, we conducted so many PPH workshops, ECLS workshops throughout the state, excellent work. So again, looking forward for your support and blessings throughout my tenure. Again, Shobna Patel, has lots of work we have done. One important work which we have done during Shobna's era was ATP workshop, Adolescent TRIMP workshop, with which each society addressed the students, school friends. We covered more than 53,000 students all over the state, which was acknowledged and applauded by the government of Karnataka. I thank HASSAN Society, all the members, President Dr. Savitri, Dr. Madhu, and all the members for hosting this excellent installation ceremony in such a beautiful place and taking all the trouble. Thank you, HASSAN Society. And I should thank my family, my husband, my best half, Dr. Vidyadhar Donimat, Professor of Orthopedics. His constant inspiration, encouragement, support is why I am here before you all. He is there with me always. He has encouraged me for each and everything I do. And not only in academics, I may be good in academics or a good clinician, but he has taught me financial aspects, legal aspects, administration. So only I am able to carry on the administration because of him. I immensely thank him for all his support. And today also he is with me. So always he is there, and he wherever if needed, he travels with me to see to it that I am comfortable. Thank you once again for this. And I really thank my children. Sunaina, she is an IIT, she is presently working in London. My son Kshitish, he is doing his MS in PGI Chandigarh. Both of them always encourage me. Their enthusiasm instills enthusiasm in me. They inspire me and bring enthusiasm in me. Thanks to my family for all the support, because of which I am here. And Vidya and myself are going to carry on these activities. My theme for the year, Ksoga Dares. D for dedicate, A for achieve, R for reach everyone, E for excel, and serve the humanity. I hope you like my activities planned for the year. To continue all the Ksoga, KCOG and Ksoga committee activities which have been initiated during Sir's tenure, we'll be continuing all those activities during my tenure, all the webinars of the committees and the KCOG. And also I want to thank the Ksoga KCOG team, Chairman Dr. Hema Devaka Madam, Dr. Murlidhar Pai, and Dr. Vidya Bhatt for all the blessings, support, and I seek their support during my tenure. And Ksoga KCOG CPAP program, excellent program where we have national faculty
and Disease Biology, Department of Biotechnology in New Delhi. Member of the Project Review Group on Reproductive and Child Indian Council of Medical Research, ICMR at New Delhi. He involved in Fertivision 2018 leading lights in the field of reproductive medicine for the year 2018 by Indian Fertility Society. And he was awarded Dr. Durusha Lifetime Achievement Award for the 2017 year by Indian Society of Assisted Reproductive Technology, that is HASSAN. FOGSI Dr. Kutti Lifetime Achievement Award was conferred upon sir in 2011 and 12. Dr. D.K. Tank Reproductive Health Care Promotion Trophy 2011 and 12. And he has to his credit, that's why I told that word Pratap, and continuing beyond 300 publications. I think sir's colleague, one more in Manipal, is leading by another half of this and going beyond. And 800 presentations in national and international congress, editor of 10 textbooks, and contributed several chapters to several others. Sir, if I am not taking 2 minutes extra, shall I read this small clip about fibroid that I have written? Asking pardon of each and everybody, I am consuming 2 minutes extra. Fibroids are like firebrands of uterus, as we see quite commonly in up to quarter of women. They are perceived as wildfire by us when we find them in ultrasound in asymptomatic women. And at finding them, we victimize the uterus when it is not indicated. They should be seen carefully, not even like campfire. Rather, they should be seen like extinguished campfire in the morning through some submucous fibroids. I would like to just tell one very recent past 6 month story. A lady comes from Bangalore and she gives an history of induced abortion at 2.5 months. So upon digging why it was induced, she told a non-MBBS doctor gave medical method of abortion, counseling that it would affect the course of the pregnancy. So we repented, and as she had come for myomectomy prepared, I referred her to Terikere Rajesh, and while taking ultimate informed consent, we reiterated that fibroid was not coming in the way of pregnancy. Still, if you want to take a chance for another 6 months, we would not go ahead with myomectomy for the 10 centimeter fibroid. It was quite big. And she cancelled just 2 hours before surgery. She was taken consent, everything. And within 6 months, she came with a pregnancy. And the pregnancy course was uneventful, even parturition, and she delivered full-term normal without PPH. Thank you, sir. Sir is going to enlighten us in depth about this, like these stories. Thank you, sir.
Thank you very much for introduction. I must thank Dr. Bharti Rajshekar and the HASSAN Society, and of course Ksoga, for inviting me for this talk. I know this is not the right time to talk to you all, because we are waiting for the cultural program, but I'll make it short, because I think a lot of things have changed in fibroid, because people think there is nothing much to talk about rather than just remove it. So I will take you through a little bit about the recent advances. The current literature calls for removal of submucous fibroid and possibly cavity distorted fibroids. However, removal of non-cavitary distorted fibroids is always a controversial. That means something in the myometrium distorting or not distorting is the discussion to be done. My flow of presentation for the next few minutes would be on what are the classification recently introduced. Does intramural fibroid cause infertility? Because we all said, we have seen so many pregnancies with fibroids, so we always thought it doesn't interfere, but it does. Does myomectomy improve pregnancy rate? Or how to decide the type of approach for myomectomy is important. Now if you look at that, though it's a little far, the FIGO has put 1, 2, 3, 4, 5, 6, 7, 8. I just wanted to understand, 1 means it's in the submucous one. The 2 and 3 are also, 2 is also a little bit of submucous, but concentrate on 3 and 4. We always thought that 3 and 4 doesn't matter, but it matters in infertility. So the 3 and 4 are somewhere in the myometrium, but very close to the cavity. That's the difference. 5 is beyond. 3 means it's very close to cavity and 4 is a little away. That's what we have to, that's what you mentioned about a good ultrasound is very, very important for us to diagnose where is the exact fibroid. So this, we have over there realized that the fibroids expresses lot of receptors, estrogen and progesterone receptors, which may interfere in implantation. Now with our recent advances of diagnosing the fibroids, we realize there are a lot of changes through molecular, genetic pattern, physiological changes, and of course the most impact on reproductive outcome with a specific location is what we are going to discuss right now. In the animal model, they found out the fibroid which are very close to the cavity definitely matters into implantation. That's why I said Figo said 3 and 4. We ignored that before. We thought it's nothing much happening, but it's something close to cavity. They found both the HOXA10 and the glycodelin, these are very necessary for implantation. Though it is inconclusive, certain implantation factors may change in those myomas which are very close to the cavity. So the HOXA10 has been studied extensively, and due to the time factor and too far for you to see, I just want you to understand that one point. HOXA gene has been done, a lot of experiments have been going on with these kind of different kinds of fibroids. They've also found something different which we never thought of, called as bone morphogenic protein. They found BMP, bone morphogenic protein. It's a growth factor that also can get altered in fibroids. They found the endometrial stromal cells isolated from 12 women in the initial experiment. They found out these kind of bone morphogenic protein also is being altered with fibroids. Now, interestingly, the junctional zone, between the endometrium and the myometrium is called a junctional zone. The junctional zone is important because if there are fibroids very close to junctional zone, again, because I do a lot of embryo transfers, I know we may fail. It may not matter for others, but a person concerned with embryo transfer, we have to understand the junctional zone may be altered if there are fibroids very close to that. Now what they also found was, if from far you can also see that blue dots there. The blue dots are the fibroid which are very close to the cavity. Now they found that there are uterine contractions are occurring. The myometrial contractions occur in those fibroids which are close to the junctional zone. That means I do an embryo transfer, if the fibroids are very close to the cavity, it may get expelled. That is why the uterine contractions have been documented by different methodology. There are different kinds of contractions. Now when we look at when you do a myomectomy, sometimes we are very erratic. We just remove without even knowing what we are removing. The fibroid pseudocapsule is very, very important because it contains blood vessels. If the blood vessels are preserved, I think that uterus will get good blood supply. So when you do a myomectomy, think about the capsule. Don't remove the capsule, but just work within the cavity and remove the myoma and preserve the capsule because that is necessary for the blood supply. So the fibroid pseudocapsule contains it contains muscle cells and of course neurotransmitters. The neurotransmitters have been understood there, and they sometimes, because there is neurotransmitter, uterine contractions are more in certain of these fibroids. This is just to show how a myomectomy, we know we have to remove the myoma by doing encapsulating the whole thing, but understand the pseudocapsule, the presence of pseudocapsule and the associated cytokines, growth factors, and hormones may be responsible for the abnormal uterine peristalsis. I'm just hopping on the same point. There is a peristalsis. There is uterine contractions occurring because of all these neurotransmitters, cytokines, and so on. That is why a woman with fibroid uterus may get into preterm labor. That is why we cannot ignore when somebody is pregnant, they may get abortion, they may get an abortion or preterm labor because this capsule has neurotransmitters, this capsule has cytokines, and all these fibroids are having some kinds of contractibility. That is why they get into preterm labor. Do not avoid, just because she's fibroid and nothing happens, they may get into preterm labor. We have to take care of that. So it's not seen anyway. So I can just skip some of the things. Now, does the intramural fibroid, what I mentioned about 3 and 4 fibroid FIGO, which is not distorting, does it matter? I think it matters because in certain conditions. If there are lots of studies which you cannot see so far, but I would like to say that all the contractions have been analyzed in different situations and they have proved that even these intramural fibroids, which are quite big, what is big, nobody has said. But if it's very close to the cavity junctional zone, that matters. If I have done IVF or embryo transfer, if I fail the first time, I may remove that little small myomas which are close to junction zone also. Long back we thought need not remove. But I think I would remove a myoma even in the myometrium if I failed in my first embryo transfer before I transfer the second time. The small intramural fibroid, which is a new thought, of the type 3 and type 4, probably affect fertility and decrease the pregnancy rates and even live birth rates. It is difficult to decide which patients we should remove the myoma, either surgically or non-surgically. So does removal of intramural fibroid, the myomectomy, improve pregnancy rates? Yoshini et al. Identified patients of fibroids who have increased frequency of peristalsis. What they went one step higher. Even the small little fibroids, if they failed in embryo transfer, they started studying the muscular contractions, the peristalsis, which you have never seen. So they have proved there are certain fibroids having more peristalsis. That means if a woman is having more peristalsis by some technique which they identified, you have to remove those fibroids. How to do that was MRI. It's called a cine MRI, CMRI. They studied by cine MRI the peristalsis. That's a new recent advance in finding out which myoma has to be removed when we have failed in the first time. I'm not talking about remove everybody, but when you have to transfer embryos, you do it. So several studies have proved that cine MRI has proved that there are uterine peristalsis in the myoma. The location matters. Where is the fibroid? It's the submucous one, everybody knows. Given the new molecular data implicating both submucosal and intramural fibroids having deleterious effect on the endometrium, there is no doubt that FIGO3 especially, not 4, FIGO3 would have a negative impact on implantation. FIGO3, I repeat again, a small myoma very close to junctional zone, we thought it is not significant. So lots of studies have proved, many studies have proved that this peristalsis has been proved beyond doubt. The debate still remains regarding the tumor size. What is the size which is significant and which has a negative effect? That has not been clarified, but again we cannot see. But they have found anything around 2.8 centimeters. That means 3 centimeters also is significant in the intramural myoma, which is close to the cavity. So now the recommendation is to remove even a 3 centimeter fibroid if it's very close to junctional zone. They have said 2.8. But most of the literature says 4 centimeters. But I don't think 3 and 4 matters. If it's close to junctional zone, even a 3 centimeter myoma has to be removed laparoscopically, then just leave it like that and get another embryo transfer failure. I'm talking about IVF embryo transfers only. Somebody conceives is well and good, but they all get into preterm labors. Because myometrial peristalsis have been studied, they found different kind. You know, long back we were taught, interestingly, physiologically, during ovulation, the sperms have to go inside, isn't it? So the contractions are upwards. That is why retrograde menstruation, endometriosis occurs during menstruation and till ovulation. After ovulation, it is opposite. The contractions actually go down. That is why the progesterone stops these contractions in a way. That is why we give sometimes progesterone after most of all the cases of embryo transfer, we give progestogens. It will stop the contractions and improve implantation. That is why the contractions have been studied in both directions, and they found it is much more when it is FIGO 3 and sometimes FIGO 4. So altered contractility has been proved beyond doubt. Directions, I have told you about that. Frequency, we'll skip all that. The results show 34% of pregnancy rate in the low frequency group, that means low peristalsis, while 0%, almost 0% in the high peristalsis. So we are going one step ahead. I was just thinking we are going to, I am now the head of a new department called Reproductive Medicine and Surgery. I don't do much of obstetrics and gynecology till 1 year back. This has changed. We are going to start MCH work. MCH seats have been allotted by the national board. I was just thinking, why not study the peristalsis for the MCH students, because there's nothing else to do. Sitting there, something new has to be done. So I think cine MRI may be something nice, interesting to study and prove about all that. Now they also found that the uterine peristalsis may change the intrauterine pressure. That is why the embryo may get thrown out by the peristalsis. So what is the alternative for myomectomy? I don't think we should do all kinds of medication, but you can try medical management, mifepristone, for a short while. I had one patient who had a very small fibroid on the cornu. It was just 1.5 centimeters. And I failed in my embryo transfer first time. And she had severe dysmenorrhea. I just didn't want to operate on her. I gave mifepristone for about 1 or 1.5 months. And I saw her, the fibroid became very small. I continued for another half a month. So 2 months time, I couldn't see the fibroid at all. It just disappeared. Not disappeared, at least it went away from the cornu. It is my own experience. I did embryo transfer after 1 month after that, and she conceived. I didn't operate, but I used medical management also in infertility, only in certain situations where it is in the cornu causing severe pain. You can also do sometimes young girls having little cornual fibroid. They are not coming for fertility, but they come for symptoms. Why not give mifepristone for those cases? I don't do the HIFU, which is my friend in Malaysia, Dr. Selva does that. That is high intensified ultrasound rays, which can also be done. I'm going to skip all that. Now this is another introduction. I'll go to wind up in a couple of minutes. I just want you to understand, there's one intelligent fellow called as Lasmar. This Lasmar said, this is called as Lasmar et al. In 2005, we have missed this publication totally. I'm following this principle. I want you to understand because Lasmar said step W classification. S means size, what I was talking about. T means topography, where is it? E means extension of the base in relation to the uterine wall, which I'm talking about, the junctional zone. Penetration in the myometer means how far has it gone? P, penetration. And W means lateral wall. It's interesting for postgraduates or even for us. I follow this in my clinical practice. I'll tell you why. Because the size, topography, extension of base, penetration and lateral wall means step W classification introduced by Lasmar. Now why is it important? I'll show you that. Forget about the dose anyway, you cannot, the score you cannot see from there, but you can always refer. Madhu, Davangere, you can go and refer and tell your postgraduates. This Lasmar is for us, for surgeons. I'll tell you why. Forget about the score, I'll just show you this. Now what they found is, where is the myoma, where is the topography, 1, 2, 3, extension from the base and penetration, how far has it gone? Why I'm going to stress on that one statement is, if you think you can operate from hysteroscopically, because bulging there, and most of it is inside, you will fail in hysteroscopy. If you do this scoring, you will not do hysteroscopy, but you'll do laparoscopic removal. Many times what I'm finding, hysteroscopic people do one sitting, then they'll say next sitting. So second time they have to come. But if you introduce this classification, step W classification, and it's also called once again as Lusmark classification, you can decide how to operate. And I'm doing it extensively in my career, in my practice now. I calculate the scoring. I'll say, no, this is not for hysteroscopy. This is for laparoscopy. I think just a change. All of us endoscopic surgeons have missed this publication, which came up 16 years back. And I think it's a very good classification, and nobody talks about it. Because we are doing unnecessary two-sitting hysteroscopic surgery, which I've been seeing on webinars, which is not necessary. You can just go laparoscopically and remove. The advantage of this classification has a high correlation with complexity and degree of technical difficulty in performing the right kind of surgery. It is related to the operative time, directly related. We are finishing it fast rather than hysteroscopically. There is no fluid absorption because we are not doing hysteroscopy, and validated to predict complete or partial resection of myomas. Completion of myomectomy is much better if you follow the simple Lusmark classification. I'm not going to talk about all this. We'll just skip that. The role of fibroids in infertility has been extensively dealt with. I'll skip all this because the time factor. But I just want to introduce one more thing. You know, when I got another patient who got recurrences 3 times in 1 year. So I got very much worried because whether she get into leiomyosarcoma. So actually when I did myomectomy, the report came as stump, S-T-U-M-P, which I didn't know what it was. I just wanted to understand that pathologists, what they said, stump. Stump means cricketers like the stump. But I got worried about that new word. Leiomyosarcoma, we know uterine fibroids gets into sarcoma. In between, it's like a cancer cervix, CIN. Like that in the myoma they found out. This is called as stump. It is called as smooth muscle tumor of uncertain malignant potential. So we may find as an infertility expert recurrences stump. I repeat what I said. Stump means smooth muscle tumor with uncertain malignant potential. Your pathologist must know this new terminologies. Only then you will be able to understand. Because when you get a stump report, in your histology, you should not postpone fertility because you may get into leiomyosarcoma. You finish the IVF embryo transfer at the earliest because the stump, you cannot wait for another recurrence. So my patient had 3 times recurrence in just 1 year. And she wanted hysterectomy and not pregnancy because she thought she'll die of cancer. But I didn't want to do that. I did embryo transfer. She became pregnant. After that, I did hysterectomy for her. So this is important to know. The uterine smooth muscle tumor has been defined completely differently now. So stump is a smooth muscle tumor which features that preclude an unequivocal diagnosis of leiomyosarcoma, but that do not fulfill the criteria of sarcoma. Hence, it has been put as stump. If we look at that, from benign to malignancy, the stump comes somewhere in between, which is a new thought, came up long back in again 2015. But we gynecologists did not know this because nobody spoke about it, including our pathologists didn't tell us. So I went to the pathology HOD and said, why don't you read and report next time before it becomes a leiomyosarcoma. So let's skip all that, and then I'll just conclude by saying, to conclude, understanding the pathophysiology has improved our decisions of myoma and fertility. Non-cavitary intramural fibroid also is a challenge to understand. There appears to be enough evidence that non-cavitary intramural fibroids also affect myomas or fertility. And type 3 is a very good observation of FIGO for people like us doing IVF and embryo transfer. Since disruption of the junctional zone occurs with type 3 and type 4, we need to remove them if we fail in the first embryo transfer. And myoma has been always a perplexing problem. We are understanding more and more of myomas in the future because genomics, genetics, everything comes back into understanding for the future. Thank you very much for inviting me and for your patient listening.
Felicitations.
Thank you, sir, for giving us a concise information of such a vast topic. Now we would like to continue with the felicitation ceremony.
It is pleasure to be here in Hassan with a beautiful weather, and it is the place which is known for its hospitality and beautiful smile and with a good-hearted people. It's time from Ksoga to felicitate the stalwarts and people who have been given their contribution to take the Ksoga to the greater heights. I would like to call upon the following names. I request them to come onto the dais. Dr. Pratap Kumar, Dr. Amrish Bandiwad, Dr. Padmini Prasad, Dr. Bharti Rajshekar, and Dr. Rajshekar. Dr. M.G. Hiremat, sir, Chief Patron of Ksoga, without which Ksoga cannot even take a single step. Dr. Rajshekar, Dr. Rajshekar, API President, who has been supporting HASSAN OBG Society as well as Ksoga. next batch of people to be felicitated. Dr. Babita, Dr. Sonia Mandappa, Dr. Rajalakshmi. Sir, Dr. Shobha Bembalgi,
all EC members, please come. Shobha Bembalgi, Shobha Gudi, Suman Gadde madam, all my team should come here. Sonia Mandappa.
ಆಯ್ತು. ಕೂತ್ಬಿಡಿ.
Sonimar, Dr. Manjula Patil, Dr. Savitri.
Call upon MQ, Mr. Shrikant, Mr. Shivank and Mr. Sandeep. We thank the MQ division for helping eradicate anemia in India and in Karnataka, and at the same time they have helped HSOG in conducting this program in such a successful way. the Ksoga office bearers to kindly come on stage. Dr. Shobha, Dr. Suman. Dr. Vidya Tobbi, Dr. Shobha Gudi. And Dr. Ambrish Bandiwat, ex-presidents Ksoga, to kindly come on to the stage. Sir, please. Manjula. Oh, Manjula ne markbitvi star ne illi. Oh, Manjula. We have forgotten the star. Aur Suman get. Iri, one nimsha, please wait. We will all join the group. Sumana madam. Okay, that's not wrong.
Dr. Padmini Prasad on stage, please. Dr. Rajalakshmi on stage, please.
Dr. Sonia Mandappa madam, Dr. Rajalakshmi ma'am. Dr. Madhu. Dr. Madhu, sir, please.
Kasturi, check to mandana 2 sal aate. ಅಲ್ಲಿ ಬರ್ತೀನಿ.
We come to the end of the official ceremony. I call upon Dr. Girija Prasanna Madam to deliver the vote of thanks.
Thank you one and all for joining us with this auspicious occasion. I'm happy to be here to propose the vote of thanks. At the outset, I thank everyone gathered here. I thank today's chief guest, Shri Girish R, for his presence in spite of his busy schedule. I thank our DHO, Dr. Satish, guest of honor, for his cooperation to our activities. I would like to express my gratitude to Dr. M.G. Hiremat sir for being the pillar of Ksoga and always encouraging for all the activities. I would like to thank Dr. Basuraj Sajjan sir, who is the spirit and soul of Ksoga. I would like to thank and congratulate Dr. Kasturi Donimat ma'am. We look forward to your tenure, ma'am. And I would like to thank Pratap Kumar sir for delivering an excellent speech on fibroid and infertility. I thank our own dynamic Dr. Bharti Rajshekar ma'am, who is Secretary General Ksoga and soul of HSOG, without whom this meet wasn't possible. I would like to thank Dr. Durga Das Astranath sir, Treasurer Ksoga, for being part of this program. I would like to thank all the EC members, past presidents, chairpersons of Ksoga committee, presidents, secretaries of various societies present here. I would like to thank our Dr. Savitri ma'am, President HSOG. She's been a pillar and strength since many years to our HSOG for all the activities. Thank you, ma'am. I would also like to thank our own beautiful Dr. Babita, who is an organizing secretary, zonal meet. I thank all the HSOG members for their active participation. I thank Hotel Ashoka for providing the venue and accommodation seamlessly. I would thank Mr. Sunny and the audiovisual team. I would like to thank the media persons present over here for their extensive coverage.
I would also like to thank the sponsors, MCure Pharma, Alembic Pharma, Bayer Pharma, and Oaknet Pharma. I thank one and all here. Thank you.
From Ksoga, we want to thank the host society, HASSAN Society. Your hospitality was beyond imagination. Thanks a lot. Hip hip hooray to HASSAN Society. Hip hip hooray. Hip hip hooray. Hip hip hooray. Thank you.
Last but not the least, Dr. Sonia Mandapa, our Safe Motherhood Committee Chairperson of Ksoga, wants to felicitate office bearers of Ksoga, Dr. Sajan Sir, Dr. MG Hiremat Sir, Dr. Bharti and Dr. Durga Das. I request them onto the dais, please.
Very good evening. Without wasting much time, I take this opportunity from Safe Motherhood Committee to congratulate Dr. Hiremat and Dr. Baswaraj Sajan, Dr. Bharti Rajshekhar and Dr. Durga Das. For this, I request our advisors of the committee, Dr. Vidya Tobi, Dr. Amrish Bandiwad and Madam Dr. Shobha Bembalgi to please come and felicitate. I also request our next president after 20th, Dr. Kasturi Donimat, to please come on to the stage. So as we've been listening from our COVID president, I quote, we break the word COVID. C, who gave us courage. O, who provided opportunity. V, was very supportive. And I, who gave informative lectures. President. And D, lastly, dynamic and winding off with duck speech today. I'm very happy our Safe Motherhood Committee team is with us today. And on behalf of all of us, I congratulate the team and welcome our new dynamic president, Dr. Kasturi Donimat. My special thanks to my own friend, Dr. Manjula Patil. And in this forum, I would like to mention my backbone support of the team, Dr. Hema Divakar, and also constant support from our Foxy Safe Motherhood Committee Chairperson, Dr. Preeti Kumar. Thank you, one and all.
Good evening, all of you. I and myself and Vidya Thobi, I think we should immensely thank Sonia Mandapa for active participation throughout the year. The many more programs she did as a capacity of chairman of Safe Motherhood Committee. Hats off to you. Thank you, Sonia.
Yes. Congratulations to all new office bearers and congratulations to all the committee chairpersons, EC members, and especially Dr. Sonia Mandapa. And we intend to do many more programs under Safe Motherhood Committee.
Hello. Good evening to everybody. Last year when we formed these committees, we did form 20 committees. Out of 20 committees, 2 committees have excelled. One is Safe Motherhood Committee, another is a Sexual Medicine Committee for having done maximum number of academic program. Dr. Padmini Prasad Madam, please come to the dais. I think special congratulations to these two committee chairpersons who have done the maximum number of academic programs throughout the year. Thank you very much. Madam. Thank you, Sonia. And thanks to Mr. Arun, who is the backbone of our flyer. You ask him to do the flyer in the morning, by evening he will be ready with flyer. Only thing is he will put the photo of the different person. Thank you, Arun. Good, madam. So, on behalf of Ksoga, we would like, I think this should be an inspiration to other 18 committee chairpersons, because when we announced the chairpersons last year, we have told them that they have got 2 years tenure. Just 1 year has completed. You have got time to do your activities in the next year also. I expect next year more than 10 committees should be honored like this, so that all the committees will become very, very active. Thank you, Sonia, and thank you, Padmini Prasad Madam. I think special thanks to Padmini Prasad Madam, because the committee which was given to her was Sexual Medicine Committee. And it was so difficult to bring the awareness about that. I think Madam has taken lot of pains. Thank you.
I thank each and everyone. I am very highly thankful to all the people, HASSAN Society and Ksoga. So I wish all the best for the new president and the president-elect and the committee. Thank you.
ನೆಕ್ಲೆಸ್ ಬೇಕಾ ಬ್ರೋ ಅವ್ರಿಗೆ? ತೆಗಿತಾರೆ. ಆಯ್ತು ಸರ್, ಓಕೆ.
tuned for the surprises.
Everyone, I hope everyone is having great time. Now we'll start with our entertainment session. Can everybody come in the... Come back here in the front. Those who are at back enjoying their food, can you just come front?
Let's have
Thank you, Manjula.
Thank you so much, ma'am.
Let's go back in time. We will have a retro dance from our versatile Secretary General, Dr. Bharti Rajshekar.
ಬಂಗಾರ ನೀನು ಹಣೆಯ ಸಿಂಗಾರ ನೀನು ನಿನ್ನ ಕೈಲಾಡೋ ಬೊಂಬೆ ನಾನಯ್ಯ ನಾನಯ್ಯ ಬೊಂಬೆ ನಾನಯ್ಯ ಬಾಳ ಬಂಗಾರ ನೀನು ಹಣೆಯ ಸಿಂಗಾರ ನೀನು ನಿನ್ನ ಕೈಲಾಡೋ ಬೊಂಬೆ ನಾನಯ್ಯ ನಾನಯ್ಯ ಬೊಂಬೆ ನಾನಯ್ಯ ತಾನೋ ತಂದಾನ ತಾನೋ ತಾನೋ ತಂದಾನ ತಾನೋ ತಾನೋ ತಂದಾನ ತಾನೋ ತಾನೋ ತಂದಾನ ತಾನೋ ನಾನಯ್ಯ ಬೊಂಬೆ ನಾನಯ್ಯ ಬಾಳ ಬಂಗಾರ ನೀನು ಹಣೆಯ ಸಿಂಗಾರ ನೀನು ನಿನ್ನ ಕೈಲಾಡೋ ಬೊಂಬೆ ನಾನಯ್ಯ ನಾನಯ್ಯ ಬೊಂಬೆ ನಾನಯ್ಯ
Wow, super! Can anyone guess her age? Now we'll have dance by divas of Bollywood and Tollywood.
Dr. Purnima Mahesh and Dr. Vinaya Raghunath.
हाय चका चक है तू हाय चका चक हूँ मैं हाय चका चक है तू हाय चका चक हूँ मैं टपटी दोपहर सी लड़की की लहर सी मेरे जैसी चाहिए तेरे जैसे को फूल वाली डाली भी हो चंपा भी हो वाली भी हो बोलो कैसे चाहिए तेरे जैसे को पलंग टूटता पहली रात सारा मोहल्ला करता बात हुई चौबारे में बरसात कौन वहाँ था किसके साथ हाय चक है तू हाय चक हूँ मैं हाय चक है तू हाय चक हूँ मैं అమ్మి అందాంటి నీ పెళ్ళాన్నైపోయినట్టు మీరా స్వామి అంటాంటి నా పెళ్ళిటి లెక్క సక్కంగుందిరా స్వామి నా స్వామి నీ ఎనకే అడిగేస్తాంటే నీ ఎనకే అడిగేస్తాంటే ఎక్కన కోడి ఎక్కినట్టుందిరా స్వామి నీ పక్కన కూసుంటాంటే పరమేశ్వరుడే తక్కినట్టుందిరా స్వామి నువ్వు ఎన్నే దారి సుత్తా ఉంటే ఎరేయండి నట్టుందిరా స్వామి నా స్వామి నా స్వామి రరా స్వామి బంగారు స్వామి మీసాల స్వామి రోషల స్వామి నా స్వామి రరా స్వామి బంగారు స్వామి మీసాల స్వామి రోషల స్వామి That was a marvelous dance by both of you. Thank you.
Beautiful.
ಡಾಕ್ಟ್ರು ಡ್ಯಾನ್ಸ್ ಮಾಡ್ತಾರೆ ಅವರ ಅವರಾಗೆ ಚಾನ್ಸ್ ಇದೆಯಾ ಅವರ ಚೆನ್ನಾಗಿ ಮಾಡ್ತಾರೆ ಒಂದು ಚಾನ್ಸ್ ಕೊಟ್ಟರು ಟೈಮ್ ಇದೆ
Sia. Now we'll have solo dance by Sia. Miss Sia.
gugu bada badam, badam badam, takka badam. Amagati na gugu bada badam, badam badam, takka badam. Amagati na gugu bada badam.
रोमियो रोमियो भड़के प्रेमियो काहे गले पड़े हो बिन बुलाए बारातियों ये तो कहीं गले जा संग में हमर ये जा ये तो चोरी ऐसी ना होगी कभी लगे मोनालिसा कभी कभी लगे नमिता और कभी जैसे कानम वाली हाय मेरी परम 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 सुंदरी हाय मेरी परम 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 सुंदरी
Ramula, Ramula, and now I'm chasing the road. Ramula, Ramula, now I'm chasing the road. Ramula, Ramula, and now I'm chasing the road. Ramula, Ramula, now I'm chasing the road.
Wow, beautiful performance by a Little Mermaid.
ಹೌಲಾ ಹೌಲಾ ಜೀವನಿ ಜೀವನಿ
Now we'll have one more dance by Miss Jeevani. Come.
ಬಂದ ರಾಜಾಧಿರಾಜ ಇಟ್ಟು ಸಿಂಹ ನಡಿಗೆ
ಹೌಲ ಹೌಲ
ಸೂರ್ಯ ಸಮನಾದ ತೇಜ ಅನ್ನಿರೆಲ್ಲರೂ ಉಗೆ
ಗರನೆ ಗರ ಗರನೆ ಗರನೆ ಗರ ಗರನೆ ಗರನೆ ಗರ ಗರನೆ ತಿರುಗಿದೆ ಧರಣಿ ನಿನ್ನ ನೋಡಿ ತರುಣಿ ಗರನೆ ಗರ ಗರನೆ ತಿರುಗಿದೆ ಧರಣಿ ನಿನ್ನ ನೋಡಿ ತರುಣಿ ಲಲಧಾಮಣಿ ಗಜಗಾಮಿನಿ ಬಳುಕು ನಡಿಗು ಗುಂಬುಕೋ ಜಡೆಗೆ ತಲೆ ತಿರುಗಿದ ಧರಣಿನ ತಿರುಗಿದ ಅಮಲಿನರೇ ನಾಗವಲ್ಲಿ ಗರನೆ ಗರ ಗರನೆ ತಿರುಗಿದೆ ಧರಣಿ ನಿನ್ನ ನೋಡಿ ತರುಣಿ ಗರನೆ ಗರ ಗರನೆ ತಿರುಗಿದೆ ಧರಣಿ ನಿನ್ನ ನೋಡಿ ತರುಣಿ ಬಾಣದಂತೆ ಮೊನಚು ನಿನ್ನ ಕಣ್ಣ ಅಂಚು ಬಾನಸೀಳು ಮಿಂಚು ನಿನ್ನ ನಗೆಯ ಸಂಚು ನಿನ್ನ ಪಾದ ಹೆಜ್ಜೆಯ ಇಡುವೆಡೆ ಭೂಕಂಪನ ಗುಟ್ಟಾಗಿ ನಡೆಯುತ್ತಿದೆ ಬೆದರಿದ ನಿನ್ನ ಸೌಂದರ್ಯದ ವಯ್ಯಾರದ ಝಡಕ್ಕೆ ಸಿಲುಕಿ ಆ ಸೂರ್ಯ ಹೌಲ ಹೌಲ ಘರನೆ ಘರ ಘರನೆ ತಿರುಗಿದೆ ಧರಣಿ ನಿನ್ನ ನೋಡಿ ತರುಣಿ ಘರನೆ ಘರ ಘರನೆ ತಿರುಗಿದೆ ಧರಣಿ ನಿನ್ನ ನೋಡಿ ತರುಣಿ ಬಣ್ಣ ಡೊಂಕ ಡೊಂಕ ಸಣ್ಣ ಇಂಥ ಕಾಂತಿಯನ್ನ ಕಂಡು ತಾನೆ ಖಿನ್ನ ನಿನ್ನ ಕಂಡು ಮುದಗೋಡು ಸೋಲನ್ನೇ ಅರಿಯದ ಈ ಶೂರನು ನಿನ್ನಂದ ಕಿದು ಶರಣು ಒಲಿದು ಬಾ ನಲಿದು ಬಾ ಸವಿ ಸಲ್ಲಾಪಕ್ಕೆ ಮಲ್ಲಂಗಕ್ಕೆ ಮೊದಲ ಮಾಧವ ಮದಿಸೋಣ ನಾಗವಲ್ಲಿ ಧರಣಿ ಖರ ಖರನೆ ತಿರುಗಿದೆ ಧರಣಿ ನಿನ್ನ ನೋಡಿ ತರುಣಿ ಲಲನಾಮಣಿ ಗಜಗಾಮಿನಿ ಬಡ್ಕೋ ನಟಗೆ ಕೊಲುಕೋ ಜಡೆಗೆ ತಲೆ ತಿರುಗಿದ ಧರೆ ದಿನ ತಿರುಗಿದೆ ಅಮಲಿನಲ್ಲಿ ನಾಗವಲ್ಲಿ
Thank you. Next song by Dr. Sudha. Ma'am.
This song is to the too much bored-looking men folk, Dr. Amrish, Durga Prasad, and other men. I hope you'll enjoy it. Wait, Baralappa.
Just shop on Meesho. यहाँ दाम है सबसे कम, यानी बजट पे नो लोड.
ಸುತ್ತಮುತ್ತಲು ಸಂಜೆಗತ್ತಲು ಮೆತ್ತ ಮೆತ್ತಗೆ ಮೈ ಮುತ್ತಲು ಇಲ್ಲೇ ಬಂತು ಸ್ವರ್ಗ ಅತ್ತ ಇತ್ತ ಓಡದಂತೆ ಚಿತ್ತವನ್ನು ಕಟ್ಟಿ ಇಟ್ಟು ನಲಿಯುವ 1 2 3 4 ಸುತ್ತಮುತ್ತಲು ಸಂಜೆಗತ್ತಲು ಮೆತ್ತ ಮೆತ್ತಗೆ ಮೈ ಮುತ್ತಲು ಇಲ್ಲೇ ಬಂತು ಸ್ವರ್ಗ ಎಲ್ಲ ಓಲಾಡುವ ಎಲ್ಲ ತೇಲಾಡುವ ಚಿಕ್ಕಿ ಚಿಕ್ಕಿ ಚುಮ್ ಚುಮ್ ಚಿಕ್ಕಿ ಚಿಕ್ಕಿ ಚುಮ್ ಚುಮ್ ಚಿಕ್ಕಿ ಚಿಕ್ಕಿ ಚುಮ್ 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 ಚಿಕ್ಕಿ ಚಿಕ್ಕಿ ಚುಮ್ ಚುಮ್ ಚಿಕ್ಕಿ ಚುಮ್ ಚುಮ್ ಚಿಕ್ಕಿ ಚಕ್ಕ ಹೆಣ್ಣಿನ ಗಂಡಿನ ಭೇದ ಇನ್ನೆಂದು ಇಲ್ಲ ಮಾಪಲ್ಲಿ ಮೋಜಿನ ಮಧುರ ಹೀರೋಣರಲ್ಲ ಇಂದಿದೆ ಒಮ್ಮಿದೆ ಆಸೆ ನಮ್ಮಲ್ಲಿ ಇಂದು ಹಿಗ್ಗಿದೆ ಯೌವನ ಎಲ್ಲ ಸಂತೋಷ ನಮಗಿಂದು ಕಣ್ಣಿನಲ್ಲಿ ಕಣ್ಣನಿಟ್ಟು ಲಜ್ಜೆ ಇಟ್ಟು ಇಟ್ಟೆ ಇಟ್ಟು ಕುಣಿಯುವ 1 2 3 4 ಸುತ್ತಮುತ್ತಲು ಸಂಜೆಗತ್ತಲು ಮೆತ್ತ ಮೆತ್ತಗೆ ಮೈಯೆ ಮುಟ್ಟಲು ಇಲ್ಲೇ ಬಂತು ಸ್ವರ್ಗ ಎಲ್ಲ ಓಲಾಡುವ ಎಲ್ಲ ತೇಲಾಡುವ ಕುಣಿಯೋಣ ನಲಿಯೋಣ ಮತ್ತೇರಿ ಸುತ್ತಮುತ್ತಲು ಸಂಜೆಗತ್ತಲು ಮೆತ್ತ ಮೆತ್ತಗೆ ಮೈ ಮುತ್ತಲು ಇಲ್ಲೇ ಬಂತು ಸ್ವರ್ಗ ಎಲ್ಲ ಓಲಾಡುವ ಎಲ್ಲ ತೇಲಾಡುವ.
Wow, very nice, ma'am. You really took us to the retro time. Now, the time for the next. A group dance for fusion by Dr. Bhavya Sunil and Dr. Babita.
ಮೊನ್ನೆ
చూడు నా పాట చూడు నా పాట చూడు
Thank you, Dr. Bhavya and Dr. Babita.
After the splendid performance by Dr. Babita and Dr. Bhavya, we'll just move on to the next song by Dr. Srividya.
ಅಲ್ಲಿಗೆ ಬರಲ್ಲ ಸೆಂಟ್ರಿಗೆ ಬಿಡೋದು ಕೆಳಗಡೆ ನಿಂತ್ಕೊಂಡು ಆಡೋಣ ಅಂತ ಈಗ ವಿಡಿಯೋ ಮಾಡೋದು ಹೇಳಿ ಈಗ ನಮಗೆ ಗುಡ್ ಈವ್ನಿಂಗ್ ಎವ್ರಿವನ್. ಕನೆಕ್ಟ್ ಆಗುತ್ತಾ? ಆಗಿದೆಯಾ? ಪ್ರೀತಿ ಅಂತ ಚೋರನೇ ನೀನ್ಯಾರೋ ನಿನಗಾಗಿ ಕಾದೆಯೇ ನೀನೇತಕ್ಕೆ ಬರದೆ ಹೋದೆಯೇ ನೀನಿರದೆ ನಾಳೆಯೇ ಹುಡುಗ ನನಗೇನಿದೆ ಹಿಂಸೆ ಅಂತ ಪ್ರಾಣ ತಿನ್ನೋ ಪ್ರೇಮಿ ನೀನು ಯಾರೋ ನನ್ನೇ ಪ್ರೀತಿ ಮಾಡು ಅಂತ ಹೇಳಿ ಕೊಟ್ಟೋರ್ಯಾರೋ ಇದೇನೋ ನಿನ್ನ ನೋಟ ಇದೇನಾ ಪ್ರೀತಿ ಆಟ ಅದೆಲ್ಲಿ ಅಂತ ನಾನು ನಿನ್ನ ಹೇಗೆ ಹುಡುಕಲಿ ಥ್ಯಾಂಕ್ ಯು.
ಕಾರ್ಯಕ್ರಮದ ಕೊನೆಯಲ್ಲಿ HSOGಯ ಎಲ್ಲ ಪ್ರೀತಿ ಬಾಂಧವ್ಯವನ್ನು ತನ್ನ ಹಾಡಿನಲ್ಲಿ ಹಿಡಿದಿಟ್ಟ ಶ್ರೀವಿದ್ಯಾಗೆ ಧನ್ಯವಾದಗಳು. Now the floor is open to all.